Today I am here for you people to explain about the most important type of non-steroidal anti-inflammatory drug such as aspirin. The brand Disprin contains salicylic acid or aspirin. The acetylsalicylic acid or aspirin are non-selective COX inhibitor. Non-selective means that they will not only block or inhibit the cyclooxygenase 1 or cyclooxygenase 2 enzyme, but they will inhibit both of the cyclooxygenase 1 and cyclooxygenase 2 enzyme, which are responsible to produce the prostaglandin from arachidonic acid. The cyclooxygenase 1 and cyclooxygenase 2 enzyme produce the prostaglandin, which will be the result of inflammation. So the aspirin are block the cyclooxygenase 1 and cyclooxygenase 2 enzyme, and they stop the process of inflammation. The mechanism of action of aspirin or acetylsalicylic acid are analgesic effect, or an anti-inflammatory and antipyretic effect. First, analgesic effect. They will produce the analgesic effect in the body. They will relieve the inflammation which is produced in the skin and soft tissue of the body. They will also increase the pain threshold. But remember, the aspirin are ineffective in severe visceral pain. The antipyretic effect of aspirin is they will reset the hypothalamic thermostat, and they will decrease the fever. They will decrease the fever by promoting the heat loss from the body in the form of sweating. The aspirin are also perform the anti-inflammatory effect. They will decrease the inflammatory responses because they block both of the cyclooxygenase 1 and cyclooxygenase 2 enzyme, which are responsible to produce the prostaglandin from arachidonic acid. So if they stop the cyclooxygenase 1 and cyclooxygenase 2 enzyme, unfortunately the process of inflammation will stop, and the inflammatory responses such as swelling, pain, etc. will be eradicated from the body. Now the pharmacokinetic of the aspirin. They will easily absorb from the stomach and intestine, and they will distribute it in different body tissue. They will cross the placental barrier, but they will slowly cross the blood-brain barrier. Their metabolism occur in the liver. They will deacetylate it. The aspirin, the acetylsalicylic acid will be converted into salicylate. So they will deacetylate it in the liver. Glycine and glucuronic acid conjugation will be occur in the liver, and they will eliminate it from the body through urine. There are some ADRs of aspirin. The ADR, adverse drug reaction of aspirin, are they will produce the ulcer or GI bleeding, because with high doses, with continuous doses, they will cause the ulcer, because the aspirin, the acetylsalicylic acid, block the prostaglandin, and continuously blockage of prostaglandin, they will cause GI bleeding or ulcer. And as we know that they are non-selective COX inhibitors, so they will block both of the cyclooxygenase 1 and cyclooxygenase 2 enzyme. As we know that cyclooxygenase 1 enzyme are housekeeping enzyme. They are housekeeping enzyme. They prevent the stomach layer, the duodenal layer from the hydrochloric acid. So if they stop the cyclooxygenase 1 enzyme with continuous stoppage of cyclooxygenase 1 enzyme, they will cause the ulcer or GI bleed. With high doses and continuous doses of aspirin or acetylsalicylic acid, they will cause the salicylene syndrome. As aspirin block both of the cyclooxygenase 1 and cyclooxygenase 2 enzyme, cyclooxygenase 1 are housekeeping enzyme which produce the thromboxane, which are responsible for platelet aggregation. If they stop the cyclooxygenase 1 enzyme, so the blood thinning will occur. The blood thinning will also be occur with aspirin. Now the drug interaction of aspirin. If the aspirin are take with the warfarin, they will thinning the blood. Thinning of blood will be occur. This all about the general discussion about aspirin.